Hello, friends. Hope you all are fine and taking all the precautions. I recently ended up my 1 week practical session in the Department of Ophthalmology. So it was a good experience, and we got a lot of chance to see the various kinds of instruments in ophthalmology department and also use them. So we kind of played with the instruments, or you can say we just used the instruments on each other's eyes and just had an idea that how it works and how it feels when you kind of hold and use these instruments. So I just want to share this with my friends because I know that right now many of you are not able to go to the hospital and have any practical experience. So I have tried to take I've taken a few pictures and I've added some of the informations which I think it's important for all of us. This is just the basic, very basic. So at least we should be knowing this much at this time, and the rest of course we have to read by ourselves from the respected recommended books by our professors. So let's start. Our topic for today is instruments in ophthalmology, and let's start with the first instrument. This is this I think everyone knows, right? This is direct ophthalmoscope, and the procedure is called direct ophthalmoscopy. You can remember it like this: direct as in it is held by the clinician or doctor in his or her hand, right? Like just like kind of a rod or something it looks like, and you just hold it in your hand and put it on patient's eye, and then you see what's wrong or what's normal or abnormal in the patient's eye. One thing you have to remember is that when you're focusing on the right eye of the patient, you have to use your right eye. Like suppose I am a clinician and a patient has come, so and I'm going to use this direct ophthalmoscope on the patient's right eye first. So I'll be using my right eye to see patient's right eye. It's RRR. Similarly, my left hand, my left eye, and the patient's left eye, right? Remember this. And there are three controls, like this one is this is the light. You get to know it's on and off. This green over here, you just have to rotate this and it is on, and then if you rotate that side, the other side, it is off. And the second control is the focus. Here you will see white color. I hope you can see over here this white color. Yeah, you actually adjust your focus with this, and this is for the aperture, and this is the behind or the back side, whichever way you want to say, and this is the front side. So you kind of put this on your eye, and analyze the patient's eye. So the problem with direct ophthalmoscope is that it does not gives you a 3D image. Remember this, right? And we will later discuss differences between direct and indirect ophthalmoscope, so I'm not discussing it over here right now. So this is the first instrument, which is the direct ophthalmoscope. Now let's go to the second instrument, this indirect ophthalmoscope. So you can remember like this: indirect as in it is not held by a clinician's hand. You can see that like the doctor is wearing it on head, right? Just like kind of binocular we put on our eyes to see distant objects. So you can remember like this. So it is like this. This is the posterior or the behind or the back side, as you want to say. You can say this is on top over here, and the front one is this, right? And it is not held in hand for sure. It is something which we all can understand by this picture. The clinician wears it on the head, adjust it the how it fits on the clinician's head. And then it also uses convex lens, like this is a indirect ophthalmoscope. Now the clinician also will use a convex lens, usually plus 20 diopter, and will keep in front of her or his eye and then see the patient's eye. In contrast to direct ophthalmoscope, there was no use of separate convex lens, right? I did not say anything over there, but here a convex lens is usually used. So in direct ophthalmoscope, it is used for assessing and managing the retinal detachment of eye and many other peripheral retinal lesions or retinal problems. And this gives a binocular vision. This is a feature of indirect ophthalmoscope. Always remember this. This question can come, that binocular vision is a feature of which instrument. So it's a feature of indirect ophthalmoscope and not of direct ophthalmoscope. So now the comparison. It is important because it's been asked in questions many times, whether in your semester exams or any other entrance exams. You have to remember the indirect, the one which we have just seen, the one which is put on head, it forms an real and inverted image. And direct, the one which is held in hand, it forms erect and virtual image. Magnification of indirect is 3 to 5 times, indirect 15 times. Direct 15 times. Illumination, fundoscopy, despite any opacity, fundoscopy is possible. Here, it is not possible. Stereopsis is present, absent. Area of field in focus is around 8 disc diameters. Over here, it is 2 disc diameters. Accessible fundus view is up to or till ora serrata, and this is up to equator. For indirect, as I said, you need a condensing lens. Convex lens is used plus 20 diopter usually, but for the direct one which we hold in our hand, we don't use any separate convex lens for that. The next instrument, it is FFA. The full form is fundus fluorescent angiography. Okay, so this is used in retinal investigation. Like if you want to see retinal detachment, it is used in the investigation of acute macular degeneration, and it kinds of accesses integrity of the BRB. Now what is BRB? It is blood retina barrier. It visualizes retina, the vasculature of retina. It kinds of accesses the foveal avascular zone, and to diagnose many retinal lesions. It is used to diagnose ischemic maculopathy. So this is FFA. Maybe they can give you the instrument and say that what is the name of this instrument, or where it is used for visualizing what. So you have to keep this in mind. The next is the slit lamp. This I think most of us know, right? Slit lamp, in this certain lenses are used. Like you see this 2 long rods. The patient's over here, the patient, a tissue is kept over here, and then the patient keeps his chin over here, and then this is to adjust the patient's the head circumference. And then the other side, the doctor sits and sees, like here. Over here the doctor can see. This is for the student. Like when we used this to see the patient's eye, and the doctor was using this side, and here the patient sits usually. So sometimes certain lenses are also used, separate lenses, like for example the Goldman 3 mirror contact lenses, convex lenses. This you'll get more. If you want more deep information, you have to read the text properly. Slit lamp is considered ideal to visualize the fundus, the optic disc ratio. It is used to see the changes in glaucoma, cataract, uveitis, dry eye disease. So it is one of the instrument which most of the clinicians will use in a patient who will come to the opthal section. This is tonometer. Right now we have many different kinds of tonometer, but since I have seen this in my opthal department, so I took a picture of this. There are many other different kinds of tonometer which are held in just hand, it just looks like a pen. So I'm sure when you will read your text, you can see the image over there or Google through and see how those different tonometers are, and they have different names also. But this is the non-contact tonometer or pneumatotonometer, and this is used to measure the intraocular pressure. And what is the normal intraocular pressure? Tell me, my friends. The range is between 10 to 24 mmHg. And in which disease the rise in intraocular pressure causes a problem? A very common disease which is also considered as the second leading cause of blindness in world, and it is glaucoma. So this is your tonometer, right friend? Over here the patient keeps his or her chin, head over here, and the clinician operates from here. This is an automatic non-contact tonometer. This is OCT, optical coherence tomography. Now this also visualizes retinal detachment and acute macular degeneration, just like the FFA. FFA was also doing this, so OCT also does this. And OCT also visualizes all layers of retina, choroid, the layers of choroid and vitreous. It gives high resolution and it uses infrared light. It measures the thickness of macula. It visualizes the anterior segment structure, and as you can see, it's a non-invasive structure. It's a non-invasive procedure, non-contact imaging system. It's not a contact imaging system. It is a non-invasive, non-contact imaging system, and this is used in diagnosis of macular edema, subretinal fluid. So this is how the patient keeps his or her head over here, and this is the screen from where the clinician sees, and then the result is according to what the clinician sees in the patient's eye. So you can it's a very nice machine. You can read through it. It's very interesting. OCT, optical coherence tomography. Now this is corneal topography. The patient, as I said, the patient keeps his or her chin over here, the head comes here. This is the side where patient sits, and behind this the clinician sits and operate the device. There is just next to this device over here, there is a computer or system which has the software which has all the application for operating this device and giving appropriate results. So you can see this is the side where patient sits, and here the doctor, and you can see the system over here, right? So this is a method of imaging the cornea by projecting a series of concentric rings of light on anterior surface, and the reflected light is analyzed using a system or a computer software to produce a detailed surface information. Like you see these concentric rings, when the patient will sit over here, and when this is focused, there will be a light, okay? And when this is focused on patient's eye, you can see these same concentric rings on the patient's eye. You can see, because when I was there, I was able to see the same, these same rings in patient's eye. And it measures, as I said, it is used to measure corneal thickness, and it is used to detect keratoconus. It is used for imaging the cornea by projecting a series of concentric rings of light on the anterior surface of eye. Right, friends? Now let's go to the next instrument. This is Synoptophore. Now Synoptophore is used to test binocular single vision. This is used to investigate the potential of binocular formation in the presence of binocular function in the presence of a manifestation of squint, and it is used in assessing young children, like children who complain, who have squint problem, they can be assessed. So this is the machine which is called as Synoptophore, used to test binocular single vision. I've seen an MCQ just asking the instrument which is used to test binocular single vision is, and they have given the name of the machine, the instrument, but not the picture. But next time, who knows, they just give the instrument picture of the instrument and not the name. So you have to make sure how Synoptophore looks like, and it is used to test binocular single vision. Okay, friends. Now, this we know, right? We all know what is. This is Schirmer tear test strips, and this is a strip I took out and took a picture of it. This is what it looks like. You put one. This is for the right eye. This is for the left eye, as written. And we know that it measures tear secretion, and it is used in diagnosis of dry eye disease. And we also know that less than 6 mm of wetting after 5 minutes indicates tear deficiency. So less than 6 mm, remember this digit 6 mm, less than 6 mm of wetting after 5 minutes will indicate tear deficiency. So these are the instruments which I got an opportunity to see in my ophthalm department. But there are many other instruments. When you will read ophthalmology in detail in your textbook, or when you will see videos, you'll come to know there are many instruments like Keratometer, Retiniscope, different kinds of tonometers, tonopen, Maddox wing, Maddox rod, Hertz exophthalmometer, and B scan ultrasound is also done. So they have different kinds of more instruments in ophthalmology. Go ahead and read and try to keep the image of these instruments in your mind, because sometimes they will not give the name of the instrument but the picture and will say this is used to do what, or they will just give you a function and ask you this is done by which machine or which instrument. So you have to know also what the device or the instrument looks like. Okay friends, that's it for today. I hope it helps. Thank you so much and stay safe.